Hello everyone, and welcome to this audio podcast series on the Illmatix series. This is an audio podcast surrounding joined up thinking in context of healthcare, and this is another audio podcast another audio podcast in the series as part of a in a new series as part of a Storm Robotics production. And so, in this particular audio podcast, surrounding joined up thinking in context of healthcare, what I thought I'd do would be to highlight and sort of answer a question, a specific and a particular question, and that is to say, do we need more joined up thinking between healthcare sectors to support aspects of patient care or recipients, patient care recipients in different sort of healthcare conditions, and also a sort of a side question as well. Do we need more joined up sort of thinking between healthcare sectors in context of diagnosis, in context of diagnosis, laboratory medicine, pathology, and also in and around specific areas of healthcare practices. And so to answer this particular question or focus, I thought I'd look at excuse me. I thought I'd look at this from two different two perspectives, or two in sort of twofold. Number one is to sort of highlight the importance or the basis surrounding integrative practices, but also aligned to sort of healthcare partnerships, or healthcare professionalism, and also aligned to sort of electronic patient records. And apologies in advance. Some of the sort of aspects in this particular audio podcast have been highlighted in some perspective in previous audio podcasts. However, in this particular audio podcast, I thought I'd provide a sort of more sort of robust perspective. So the second part of this, or sort of objective in this audio podcast is to explore why it is also advantageous to implement sort of multidisciplinary team meetings, or MDT meetings, in between healthcare sectors, but also wherein in between healthcare sectors, or in between sort of multidisciplinary team meetings, or MDT sort of meetings, wherein traditionally or retrospectively there are health professionals, primarily health professionals within different specialties, for example. And normally and historically, the basis is around frontline health professionals amongst different specialties, providing a basis around aspects of healthcare, in aligned to aspects of patient care, or healthcare, as it would be, wherein health professionals in MDTs are in communication, or generally where those meetings or MDT sort of meetings take place, where there's normally or retrospectively, where retrospectively there's health professionals amongst different specialties, health professionals with other health professionals, and communicating aspects of healthcare, aspects of healthcare between each other. Whereas in sort of in sort of in sort of in sort of more recent literature, alongside some in some alongside aspects of certain aspects of practice. Um, there is sort of this basis where, for example, health professionals, as well as those in those in healthcare generally, for example, wherein between healthcare professionals and those who are those in healthcare, wherein in more sort of recent literature, there's sort of there's perspective to almost sort of underpin a basis where, for example, health professionals as well as patients should be involved in multidisciplinary teams or MDT meetings, sort of um, in MDT meetings together, and in a way where, for example, the wherein healthcare aspects are aligned to aligned to sort of a sort of a premise or basis around patient centeredness, wherein there's where joined up thinking is underpinned, or a basis in and around in and around collaborative way of um, uh, sort of integrating aspects of healthcare. So generally speaking, patients within healthcare, or in aspects of healthcare, account for around 50% of primary care physician appointments. For example, around 64% of sort of what are referred to as outpatient appointments, and also around about 70%, almost 70 or 80% of admissions, admission into hospitals, for example, depending on the basis of health concern. Around 70% of total sort of health and expenditure is generally attributed to patients or individuals or recipients, for example, with particular health conditions. And there's literature and literature uh, 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 that is sort of available through sort of search engines to sort of substantiate the basis around this. And people diagnosed with particular conditions are perhaps the most, or at least where it's been documented, are the most sort of rigorous sort of users users of aspects of healthcare, around healthcare. And despite overwhelming evidence, patients can face a number of challenges, and already that, or at least again in the literature, there is understanding that the 30% of the population, 30% of the population with particular healthcare conditions, health concerns or health conditions, account for, again, the majority healthcare sort of expenditure in and around different aspects of healthcare. Now, reducing the sort of reducing uh, uh, so sort of to begin with, in context of joined up healthcare, reducing the public's dependence on healthcare professionals and increasing a sense of control and well-being is perhaps a more has been viewed as, in literature and documented works, as perhaps a more academic and a sort of effective or efficient way of seeing patient care, sort of seeing patient care being more progressive. However, in line with this, there are, as listeners would know, in some way that there are ongoing, and there are issues, or there can be, or there have been sort of current issues around this. So, although research has provided valuable insights into some of ways service users develop aspects around healthcare services, it is important to gain a better understanding or insight into the type of stressors that are experienced by patients suffering from different diseases, and by implementing sort of a more integrated services between healthcare sectors and improving healthcare experiences, and in context of in context and relating to healthcare experiences, something that has been mentioned in sort of previous audio podcasts, is something that's abbreviated to PROMS, which is an abbreviation for patient-reported outcome measures, and PROMS, in relating to PROMS and patient-reported outcome measures, it then refers to it then is in reference and in regards to healthcare experiences, and in line to this, by implementing those integrated services between healthcare sectors, the PROMs, or patient reported outcome measures, alongside experiences, can improve can improve well can improve can improve patients can improve patient care, if there is more joined up and collaborative way of looking at healthcare, and also understanding how patients and the public access healthcare, access information, access understanding. And what I mean by this, listeners, is not in reference to, for example, app technology or using different apps, for example. It is actually it is the crux, the basis, where understanding how patients and the public access healthcare and information, at the sort of crux of healthcare, and between healthcare sectors. and there needs to be a sort of a sort of a basis and understanding through how sort of directories, information, leaflets, documents, books, and resources aligned to healthcare information could be better better could be better for the public within for the public sort of more generally. And the sort of issue the issue excuse me, one of the main issues with current practices in between healthcare sectors is that there has been a lack of or there has been and is a lack of integration between healthcare sectors, but also but also unfortunately between healthcare sectors, and where there is a fragmentation between healthcare sectors and community. So, in context of this now, I'm going to highlight some aspects that are in regards to what's referred to as health literacy. Now, patients whose first language, for example, is and may not be English, for example, approaching health literacy or aspects that align to health literacy can be can be challenging and can be challenging and can result in a sort of it can result in sort of a deficit in relating to and in regards to the sort of joined up thinking, and also the sort of collaborative construct between a sort of patient and health professionals, which is not has not really been actioned in between any healthcare sector between any healthcare sector sort of unfortunately. Work going back by Salter and team in 2014, they highlighted that that what that 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 in relating to patients living with chronic musculoskeletal conditions, the team highlighted that patients desired sort of a more communication and interaction, as well as knowledge as well as knowledge from healthcare professionals, and this in turn alongside sort of aspects that were related to health literacy increased a sense of empowerment between health professionals and the patients in particular musculoskeletal conditions. Importantly, as well, more evidence has shed light that people with a low health literacy tend to refer more to health professionals to make decisions for them, and this tends to have less positive health outcomes, and also in relating to patient reported outcome measures, tend to have less positive outcomes than those who are perhaps more proactive or actively involved in and around healthcare. And so, in line to sort of health literacy and autonomy are both important. And joined up thinking, listeners, is wherein from a sort of a collaborative effort can only really be achieved, because again, between healthcare sectors, health professionals generally, uh, in sort of current times, still sort of unfortunately tend to work in silos, and also where patients can and do again rely on health professionals in the main to provide the sort of do's and don'ts around particular health conditions, as and when patients go through particular aspects of healthcare. Now, aligned to health literacy aligned to health literacy as well, is something that's referred to as electronic patient records, or EPRs. There is compelling evidence that that patients who are sort of who are active or proactive in managing aspects of healthcare, or um, aspects of healthcare, and through accessing accessing sort of electronic patient records, wherein 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 generally patients in one way or another have access to electronic patient records that sort of summarize aspects around healthcare. Now, in and around this, this also means means and has meant that patients who have access to electronic patient records generally tend to have better healthcare outcomes, and thus shifts the perception where health wherein patients are seen less as sort of sort of as simple service users. They are then through aspects of electronic patient record access, and in aligned to sort of where healthcare professionals and patients have a sort of a collaborative way of viewing aspects of healthcare. This also then means that there is sort of more sort of active modalities in relating to shared decision making in and around aspects of healthcare. And there is also evidence that this can improve patients and sort of carers' understanding, and as well as sort of where patients and or carers who are active or proactive, this then leads into better healthcare outcomes. And again, There's literature that date back that go back to sort of 2007 and 2008. There thus needs to be sort of in line with this as well. In line with this as well. Um, uh, in some regard, there needs to be sort of a new in context of healthcare. For example, so in context of healthcare, there traditionally where healthcare has been where for example multidisciplinary team meetings have taken place, and again where multidisciplinary team meetings have taken place, and where professional health professionals communicate with other health professionals. Historically and retrospectively, that has been, for example, in hospital-based environments, and between healthcare sectors is healthcare professionals between in particular areas of specialisms, and between in specialisms in, for example, secondary care, and then those in health professionals in primary care, where where multidisciplinary team meetings have taken place in sort of those in sort of healthcare focused environments. So aligned to sort of environments, so to speak, that thus there needs to be sort of neutral environments where patients and health professionals can sort of come together to provide more awareness, but also sort of where neutral environment is space or is environment where patients, health professionals, the public can source literature and context to sort of heighten aspects in and around healthcare, and thus again prompting sort of more joined up sort of effort between patients and carers, patients, carers, and health professionals. And what I mean here, listeners, as well, to add I suppose, additional sort of transparency is not in context of for example, online or remote ways of working, or where neutral environment is through sort of a desktop screen, or through an app, or through smartphones, etc., etc. What I mean is neutral environment, where historically, retrospectively, neutral environment, for example, would be where patients, as well as healthcare professionals could meet, could have sort of those multidisciplinary team meetings, but also where patients and carers can access aspects surrounding their healthcare. A neutral environment, for example, would be in a library based in a library setting, and where health professionals for example, professionals within in library settings can support patients with aspects of healthcare aligned to literacy, etc. Now, in line with improving health literacy, electronic patient records, learning and development can also prompt can also prompt and could also prompt sort of more collaborative and sort of partnership working, wherein, for example, patients and carers aren't seen or viewed as mere recipients, and thus also where patients and professionals where patients and carers, for example, through aspects aligned to health literacy, for example, and aligned to for example, electronic patient records, but also through other sort of modalities, are become apart from for example becoming more as for example partners or collaborators in healthcare. It also shifts again the perspective where, for example, patients and carers uh, uh, patients and carers historically as in historically and retrospectively are viewed as sort of mere recipients of healthcare, wherein the mindset and the attitude of health professionals, for example, um, is or has been, for example, oh, he or she is just another patient, and that, listeners, is um, where and what is um, actually really the issue in healthcare, because no one between whether health professional, whether it's health professionals or it's patients or carers or patients, for example, more specifically, in and around particular conditions, um, sort of the professional aspects in context of health professionals, and then patients, as well. The issue or the issue around this more specifically is that um, either way, patients and carers view health professionals as as those who provide care or service providers and rely on them, and where health professionals health professionals generally are those health professionals who can often refer to patients, and carers, as well as basically those who are just are patients, for example, and thus again through collaborative efforts, or in partnership, a sort of partnership mentality, there is more, the sort of the aspects aligned to sort of compassion, are actually are also become more in depth and heightened as well. Now, in and around, sort of again, to place some emphasis on patient-centered multidisciplinary team meetings. Patient-centered MDT meetings would help to increase knowledge and health literacy at various stages of healthcare, and where health professionals within practices between specialisms, for example, should physically involve patients. There should be a sort of call for efforts to physically involve patient perspectives and encourage more shared decision making, and these should take place away from should take place away from those environs where, for example, patients and professionals, once in those particular environs, for example, have particular barriers, and so therefore once barriers are there, the collaborative or the partnership nature of healthcare completely obliterates. And so having access for example, for example, where having access to for example having access to aspects of healthcare through online or through uh, through sort of remote ways of access alone, on their own, will not and do not help or encourage patients, for example, or encourage patients or professionals to gain a sort of a confidence and understanding, and especially if, for example, both patients and health professionals can be overwhelmed by sort of the complexities, the health healthcare complexities, but also around where, for example, health literacy, for example, and again, where first language may not be, in some patients, for example, where health literacy is not is compromised owing to a language being a hindrance on patients whose first language, for example, is not English. And there's works going back as far as 2000, where Ryan and DC sort of look and investigate sort of aspects pertaining to sort of patient-centered multidisciplinary team meetings, at least in some way. Patient-centered multidisciplinary team meetings would also allow patient and carers to gain more sort of awareness around, for example, electronic patient records, and sort of where they can have an understanding of what, for example, tests and investigations, especially in around laboratory investigations and diagnostics, for example, and what those and what the investigations really mean. Again, electronic patient records versus, for example, in sort of the day to day, where in society day to day, where professional health professionals and patients generally rely more on have been relying on sort of app based technology, and thus unfortunately aligned to where healthcare is pivotal and generally important, at least where between health sectors, for example, patient care is compromised, compromised further, for example, if and where electronic patient records are not sort of accessible by health professionals and patients. And so thus electronic patient records, before So for example, before sort of app-based technologies, etc., are sort of had been a basis where health professionals, document aspects of healthcare, to help document healthcare, um, and then where patients can and should be able to access healthcare through accessing that accessing through electronic patient records or electronic health records, and thus in line with this, um, as well, shared decision making then prompts a sort of a reimagining or a rethinking of the sort of the sort of healthcare sort of to incorporate time for information, or time for information provision aligned to particular healthcare conditions as well. One of the things that excuse me, one of the things that had taken place a while ago was where there was perspectives on there was an effort where for example, the renal patient support group team, or the RPSG team, look to gain perspectives on where they asked through the membership, or the RPSG membership, where they look to or sought to gain perspectives on multidisciplinary team meetings, and the works around this had been sort of highlighted and presented actually in works by the RPSG, the Renal Patient Support Group team, in and around 2016, where they presented some bases around this work, but also as part of the health the sort of provision of information around multidisciplinary team meetings as a subject focus through the RPSG work, the RPSG team, and work that had taken place. There was in 2014 there was an effort where the RPSG team had information in a sort of a poster, and where the information was shared at a particular healthcare meeting or awareness meeting, a healthcare awareness day that took place in 2014 in and around a city in the southwest of the United Kingdom known as Bristol City. And the questions the main question was, for example, should patients be involved in multidisciplinary team meetings? And and in response, I've uh, uh, here I'm going to highlight some of the responses. So, should patients be involved in multidisciplinary team meetings? So there was a response where one of the members, one of the RPSG members, mentioned absolutely yes, and when wanted by patient, it's pos- it's it should be possible and also should be practical. It would help answer excuse me, it would help answer questions immediately rather than often where wrong or assumptions can be made. Also means that for example, patients understand better what's going on and why a particular um, uh, a particular line of healthcare is being recommended, for example. Another response was absolutely, I would love to be involved. I mean, it is us meaning health professionals that they are talking about. Number three, another response was absolutely. Quite frankly, it's frightening that we're not involved in planning our own care. Number four, I think an MDT, a multidisciplinary team with patient and care involvement would work well for people with long-term conditions. Another response was education behind purpose, behind purpose or objectives of an MDT to fellow patients and carers would resolve any issue, any initial hurdles, etc. And piloting can help measure feasibility and provide necessary feedback before any formal implementation. Number six, another response was patient involvement at MDT meetings essential to ensure that other comorbidities and treatments are considered, understood, and included in future plans. Unfortunately, um, different consultants or different health professionals do not communicate across to each other. And one of the final responses around this particular question was yes, 100%, always said that. So in line to health partnerships, or in the literature what's been referred to as health partnerships. So the need for patients to be fully interacted with treatment and care has had been highlighted in a report that was referred to as the Oneless report in 2004, which highlighted that fully interacted patients and carers were likely to save healthcare in unnecessary expenditure or funding. And similarly, the importance of supporting patient education and patient and carer learning was also emphasized in the report. And there's works that's been that was a sort of frameworked, if you like, from the General Medical Council in the United Kingdom, where they insisted that doctors must give information or understanding to patients in language and terminologies they can understand. And this is clearly quite impossible in the time available during average GP consult, general practitioner or primary care physician consultation, which has been between 7 minutes and 11 minutes. More recently, it's now gone from 7 minutes to 15 minutes. However, it's even more impossible, or can be more challenging, when the language and culture of patient is not shared by the physician. And it would be more sort of sensible to actively encourage health partnerships at sort of primary care level, so that, for example, so that patients and health professionals have a neutral place for the sharing of educational material, as well as best use of resources. This can aid to support ongoing care and increase health literacy. And also, health partnerships could allow for electronic patient record awareness as well, and where training within around electronic patient records and locations for multidisciplinary team meetings, for example, between patients and healthcare professionals, um, uh, uh, in through sort of neutral environment, or neutral environment, would again help increase sort of general aspirations of understanding particular health conditions and health care, in and around between health sector uh, and uh, and community. And so finally, I'm just going to highlight a few sort of main points. So there is now, or there has been, a need for sort of primary care physicians, or to primary care physicians, but also other health professionals, to enter dialogue uh, with um, with uh, with with to enter dialogue with patients and patient care, to prompt more integrated more integrated practice and services, and also where electronic patient records, or EPRs, generally should be supplemented by um, uh, information, information or decision support, personalized care planning, and sort of self-management education from from trained sort of allied health professionals, as well as where electronic patient records aligned alongside and aligned to sort of sort of healthcare decision support, for example, should be implemented, where there is a healthcare professional, patients sort of collaborating ensure to ensure a sort of to ensure excellence in sort of healthcare practices. And there needs to be sort of neutral environment where patients and health professionals can come together to provide electronic patient record and awareness, and where patients and the public can source additional literature and understanding and context surrounding healthcare. Because the concern is has retrospectively been um, that that the issue between healthcare sectors, and the issue between healthcare sectors and healthcare, sort of more generally, is there's fragmentation and segregation, owing to the fact that patients and health professionals are not um, sort of collaborating or partners in aspects of healthcare, and this is what generally um, from a societal basis, has caused issues throughout. There is an ongoing need to support and work in patients in partnership to increase awareness of sort of local services in health, in and around aspects of healthcare, and by encouraging sort of partnerships and inviting what's been referred in literature and in evidence as well. And there is a there is a an audio podcast in another sort of a series in another series that highlights some aspects relating regarding to what's been referred to as in literature as patient and public involvement, or PPI. So by encouraging partnerships with and inviting patient and public involvement with expertise who can effectively and efficiently add to important discussions, a requirement for health professionals and patients to enter dialogue with with and in around services 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 more generally, to prompt sort of integrated services between healthcare sectors, and again between healthcare sectors and community, and sort of those partnerships and collaborative working would bring about a deeper public understanding of healthcare between healthcare sectors. There are some resources where listeners are more than welcome to seek to identify some of the resources that I'm going to highlight. So there's works by Barnett and team in 2012, where they looked at the epidemiology of multi-morbidity and implications of healthcare research and medical education, and it was a cross-sectional study that was published in the Lancet again in 2012. There's works by Giles. There's works by Coulter and Collins back in 2011, where they published works on shared decision making, a reality, no decision about me without me, and it's available online. And there's works by Giles in 2012, where they highlight envisioning the digital hospital, the future for healthcare, and it's a viewpoint publication from Giles again in 2012. In 2014, there's works by Jones and Dutton, where they publish works on patients and families as partners in safety, quality, and experiences of care, and it was published in the patient experience journal. And there's works by Mohammed and team that look at works in and around the renal patient support group, the RPSG, and supporting patients with chronic kidney disease through social media. And it's a perspective paper that was published in the Journal of Renal Care in 2014. There's works by Snell and team in 2011, where they published works on projections of demand for social care and disability benefits for younger adults in England. and it's a report of research conducted for the Commission on Funding, Care and Support, and there's works finally by the a framework or a document, if you like, that was published in 2011 by the General Medical Council in the United Kingdom, and it was it's titled "The Patient Online is a Roadmap." That's everything in this audio podcast. Thank you for taking the time to listen. This has been the Shientist on the Illmatix series. This is an audio podcast on joined up thinking in context of healthcare. Thank you for taking the time. And there'll be another audio podcast in the series to follow. Thank you very much.